Hello, my name is Nathan Peterson, and today we're going to be talking about tics and Tourette's. Before we get into all this, are you new to my channel? And if you are, make sure you subscribe below. I am posting videos weekly about different mental health issues as well as OCD, anxiety, depression, and so forth. Tourette's syndrome is a condition of the nervous system. This is a neurological disorder. This causes individuals to have tics. Tics are sudden twitches, sounds, or movements that somebody might do. For instance, somebody might blink over and over and over again, or they might make a grunting sound. Having a tic is kind of like a hiccup. We've all had hiccups, and you think about when you have that, how hard is it to stop this? There's different tricks and techniques that people have come up with, like hold your breath, drink a glass of water, things like that, but do they actually work? Sometimes people can't stop themselves from having these tics. And even if somebody is successful at stopping, usually it comes out later. So why does it happen and who is affected? In the United States, 1 of 365 children will be diagnosed with tics or Tourette's. Usually these children are ages 6 to 17. And what is interesting are that boys are 5 times likely to be diagnosed with tics or Tourette's than females. Did you know that a majority of children actually develop a tic in their life? These tics can come and go. They might last a day, they might last a few days, but they might be something like, blinking really fast or moving their head, or it could be something they're doing with their mouth. So you think, how do you know the difference between just a normal natural tic that most people actually develop in their life and goes away, and being diagnosed with tics and Tourette's? To actually be diagnosed with Tourette's disorder, you must have at least 1 motor tic, 1 vocal tic. It must last longer than a year and must start before you're 18 years old. Also, there can be no other medical condition to explain this. To have a diagnosis of persistent chronic motor or vocal tics, it's either one or the other. You either have just 1 vocal tic or you have 1 motor tic. A vocal tic obviously is when you're doing a grunting sound or you're speaking out loud, you're saying a word. And a motor tic is something like moving your arm. Or it could be moving your eyes, or it could be moving your nose. It could be something that you're doing with your body, but not having both. You also must have been doing this for at least a year and have it start before you're 18 years old. There's a diagnosis called provisional tic disorder. This is when somebody has a motor tic, a vocal tic. They can have both, but they are lasting less than a year. This is what we look for before we diagnose any tics or Tourette's. It's called provisional because that means it can come and it can go. Tics can be called either simple or complex. A simple tic involves at least a few body parts, where somebody might be sniffing, or they're just blinking their eyes, or they're just moving their arm a little bit. A simple tic involves few body parts. So this might mean we're just looking at the face. So the face might be, you might be sniffing a little bit, or you might be moving your mouth, or you might be do something with your eyes. And how we can tell the difference between a simple and a complex is a complex tic usually involves other body parts. So somebody might be blinking at the same time they're moving their arm, or they could be sniffing while they're breathing in with their stomach as they're moving their arm. It's usually involving a few different body parts at the exact same time as the tic is happening. So as I mentioned earlier, as most people develop tics in their life when they're really, really young, sometimes they persist past the age 18. So how do tics develop? We know that genetics tends to play a part in this, that we could look at the previous generations and look at, mom or dad or grandma or grandpa or great-grandma or great-grandpa might have had a tic of some kind. They can have extreme anxiety, OCD, and it can manifest itself in a different way. Usually we see tics develop between ages 5 and 10. Also, most tics start with motor. Usually there's some body part that is moving before there's ever even a vocal tic. We find that there are times where it tends to happen more. Usually when someone is really, really excited, or they're happy, or they're super anxious, or they're really low where they're just super bored. They're not really doing much. We also find that tics can change over time, where I might be seeing someone here in my office and we create some treatment strategies for them for something that they're doing. Maybe they're blinking. That they might come back a week or 2 later and say, I'm not really blinking anymore, but all of a sudden I'm twitching the side of my mouth. And it just kind of came out of nowhere, where I can find someone actually kind of switch and swap different motor tics even throughout the day. Some come, some go away, some come back. That's just kind of the nature of tics. So how are tics treated? We use a treatment called CBIT. This stands for the Comprehensive Behavioral Intervention for Tics. I'm going to be creating a whole separate video exactly how to do this type of treatment and what it looks like. If you watched my video on BFRBs, the treatment is actually pretty similar in the way that we create competing responses. We want to get in the way of this tic happening. We want to notice these urges, these sensations, these feelings that are happening. Usually if somebody struggles with a tic, it's most of the time not the only thing that they have. They usually have a co-occurring diagnosis of some kind. They say 86% of individuals who either have OCD, depression, ADHD, which is really common, or some other developmental disorder. So most people want to know, especially parents, when do I start looking for a professional for my child to start receiving some treatment? What I say are that tics can come and go. And what I find with at least most children is that they don't tend to care that they're doing this tic unless it's starting to interfere in their life in some way or another. It's good to know the treatment strategies, but unless the child is on board with doing these, a lot of the times the treatment's going to be a little tough. I know I'm only talking about children, but adults can actually do this treatment as well. So where to start? One thing I would say is be really good at paying attention to this urge or feeling if that exists for you. It's kind of like you think about having a staring contest. Like, let's practice here. Let's gonna have a staring contest. I'm gonna count to 3, and we're gonna see how long you can go. Ready? 1, 2, 3. All right, so I'm sitting here. I've got my eyes open, and I'm just staring at you. And pay attention to what your eyes feel like. Like right now, my eyes really are burning. I can feel it. Actually, I mean, it's not that, I already blinked. Okay, so there we go. My body, my brain, everything inside of me is saying, it's saying you need to blink. It's so uncomfortable. You're not going to feel better until you blink. So blink. My eyes are starting to water. My eyes were burning. So you think of that, like I felt that urge. Sometimes it's so natural we don't even recognize it, but I felt this urge that said blink, 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 blink inside my brain. So if I don't blink, I'm going to feel pretty uncomfortable. I almost imagine somebody who is diagnosed with tics or Tourette's to have this type of feeling somewhere inside. I want you to pay attention to that. Get really good at recognizing, do I feel an urge? Yes. Do I feel an urge? No. Do I feel an urge? Yes. One good simple task you can do is if you can notice these urges, you might just sit there and practice for 5 to 10 minutes. Just put your finger up. Oh, yep, I notice an urge. Yep, I notice an urge. Yep, I notice an urge. One of the most common questions that I get from parents are, what do I do? What's my role in all this? And I say, it's really tough. You kind of got to ask the child what they want from you. Most of the time, the best thing to do is ignore it. Don't draw attention to it. Don't tell the person, stop it. You're really annoying me. Because guess what? They can't. That's like saying, don't blink. So it's as hard as it's going to be for the parent, say, hold it back. Don't say anything. Don't draw attention. Almost act like it's not there. And when we start bringing in some of these treatment strategies that I'll go over in this separate video, that is when a parent can intervene a little bit more. But we talk together as a family of what that might look like. Be patient, be loving. Your child's not doing this on purpose. And life events, places that you're going are gonna make it worse. It's those places that are taboo, that there shouldn't be any sound, something like church or a movie theater or anywhere else where their brain says, this is really quiet right now, you better not make that sound, or you better not move your body, where their brain's like, well, okay, well, you just told me not to, so I'm gonna do that now. That you kind of expect it in those moments. We don't wanna bring shame, guilt, any of that within these. Let's live life. The brain's gonna do what it's gonna do, and when we stop paying attention to it as much, we stop making it a big deal, that's when the individual feels more free from this. So have you ever struggled with a tic? Let me know in the comments below. I really would like to hear what strategies you might use, as well as any questions you have regarding tics or Tourette's. Thank you so much for watching.